Spinal fusions are one of the most common and expensive inpatient procedures in the United States. Between 1998 and 2008, the number of hospital discharges related to spinal fusions increased from 175,000 to over 400,000 per year. The current standard of care involves using a rod and screw system to immobilize the spine to prevent injured areas from moving. However, 10 to 20% of spinal screws are misplaced, resulting in increased patient pain and expensive corrective surgeries. As a result, there's a market for increased surgical guidance systems, but at over $150,000 a system, many hospitals cannot afford this equipment, which is very important for reducing placement errors. Our device helps reduce the incidence of misplaced pedicle screws by guiding surgeons during screw placement. To insert a screw, the surgeon takes a pedicle finder and creates a guide hole for the surgical screw during the operation. Now, before the operation, the surgeon identifies the optimum insertion angle that he wants to take during the surgery. However, currently surgeons do not have a good way to verify there being their optimum insertion angle. Our team has improved the standard pedicle finder with an angle detecting function to verify the surgeon meets the right angle, the right time during the operation. The final design takes the prototypical pedicle probe and attaches a glass hemisphere to function as a 2D bubble level. The glass hemisphere is filled with two immiscible liquids of different colors, with high contrast dyes to allow surgeons to quickly and accurately determine the current trajectory of the guide hole. On the surface of the glass hemisphere are markings in increments of 2 degrees from 0 to 90 degrees. Thus, this tool can be used to tell the surgeons if they have met their optimum insertion angle.
Other devices that assist surgeons in spine surgery navigation include Medtronic's Stealth System and SpineGuard's PediGuard. Both technologies are classified as Class II medical devices. We believe that our device meets the equivalency requirements for a Class II 510(k) pre-market notification through the FDA. We plan to have the bubble and the clip injection molded with at least 3 separate pieces. That would require a high capital investment of about $30,000 to make the molds, but it would produce cheap pieces and would be made in large quantities, decreasing the cost per unit to just cents. The miscible liquids will be bought from outside resources and would be synthesized by us, but the assembly and quality assurance will be done in-house. With there being close to 400,000 spinal fusions done per year and many hospitals not being able to afford current devices, we can offer a much cheaper alternative, with the selling price being just $50. Most hospitals wouldn't even get close to the cost of other solutions. With the cheap solution in the market where buyers can't afford the current solutions, we're optimistic in saying that we could capture a quarter of the market, netting us close to $5 million before costs are considered. With the help of hospitals and surgeons, we can decrease the misplacement of spinal screws.